Hi guys, welcome back to my channel Med Made Simply Easy. In this video, we're going to see about the autism spectrum disorder. In the disorders included under autism spectrum disorders are autism, Asperger syndrome, and Rett syndrome. Autism spectrum disorder. It is most common among all pervasive developmental disorders. It is characterized by qualitative impairment in verbal and non-verbal communication and imaginative activity. There is reciprocal social interactions that develops before the age of 3 years. And there is failure to make social contact, aloofness, and lack of eye contact. A typical child with autism exhibits the following features. They are usually withdrawn, extreme aloofness, communication problems, and often lives in an isolated world of their own, and poor interaction with others is also seen. They also resist any change in routine. They are also associated with learning disabilities and seizure disorder. Etiology of autism spectrum. It can be multifactorial or genetic, monozygotic, or it can also be due to any pre or perinatal injury. Now, the DSM-5 diagnostic criteria for autism spectrum disorder are: there is persistent deficit in social communication and interaction. There is restrictive or repetitive patterns of behavior or interest or activities. And symptoms must be present in early developmental period. And there is clinically significant social impairment. And symptoms are not due to other causes like intellectual disability or global developmental delay. Clinical features. Diagnosis can be made by 18 months of age, and there is poor eye contact, inability to engage socially or emotionally with caregivers, delayed speech, stereotypical body movements, marked need for sameness, and preference for solitary play. So when there is marked need for sameness, it means they usually insist on sitting in the same place or doing the same things at the same time, like that. And older children may also have a bizarre preoccupation and marked impairment in socialization. Intelligence is usually variable, and autism is commonly associated with mental retardation or normal intelligence, or specific areas of brilliance may also be seen. Differential diagnosis are seizure disorder, tuberous sclerosis, and Fragile X syndrome. Savant syndrome. Some autistic children have isolated, well-developed skills such as very good remote memory, computation, and musical ability. Investigation. So the screening tool for autism spectrum disorder is MCHAT, Modified Checklist for Autism in Toddlers for 16 to 30 months of age. Speech and language evaluation, psychological, IQ, and developmental and psychiatric assessments, EEG and MRI of brain can be done to rule out seizure disorder and other organic CNS diseases. Karyotyping is done to rule out Fragile X syndrome. Treatment. So there are 3 treatments for autism spectrum disorder. The first one is cognitive behavioral therapy, psychotherapy, and pharmacotherapy. So in CBT or cognitive behavioral therapy, intense behavioral therapy is done before 3 years of age. School focusing on speech and language development and behavioral control. In pharmacotherapy, usually drugs are not indicated for autism spectrum disorder, but drugs can be given for severe cases and also to treat comorbidities. The following drugs are given: intranasal oxytocin, atomozitine, conventional antipsychotics, and SSRI or selective serotonin reuptake inhibitors, beta blockers, and mood stabilizers. Prognosis. The factors with better prognosis are early diagnosis and intensive behavioral therapy, higher intelligence level, and presence of functional speech. Thanks for watching. Subscribe for more such videos and check the Pediatrics playlist for other videos. And also let me know your suggestions in the comment box below.